Hello, my name is Dr. Jason Woodward with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to talk to you about testing your hearing. Some people are born with hearing loss. Other people may have an illness or other reason for hearing problems. Many people will notice they have trouble hearing as they get older. How do you feel like you are hearing? Do you have to ask people to repeat themselves? Is it hard to hear the television or your friends or family speaking to you? Do you have any sounds like ringing or buzzing in your ears? If you answered yes to any of these questions, it may be time to have your hearing tested. Your primary care doctor can make a referral for you to see a hearing specialist. This person is called an audiologist. Your appointment may be scheduled as an outpatient clinic or a hospital. At your visit, the first step is to check in. The receptionist will ask for your identification and insurance card. You can bring someone you trust with you if you want. If someone helps you make decisions, tell the receptionist so she can record that information. Then wait for your turn to go inside. The audiologist will do your test. He or she will ask you some questions about your health and your hearing. He or she will use a special flashlight called an otoscope to look in your ears. If this part is hard for you, watch the video called What to Expect, ENT Exam. Now it is time for the testing. The office will have a special sound booth for you to sit in. The room is quiet and small. There is a chair for you to sit in and a window to see through. Usually, you will sit in the room by yourself. If it is hard for you to do this alone, you can ask for your support person to come with you. If you need a break during the test, ask the audiologist. Once the audiologist sets you up in the room, he or she will leave to sit on the other side of the window. You will be able to see the audiologist the whole time. The most common test is called standard audiometry. You will wear headphones. You will hear the audiologist through the headphones. The audiologist will ask you to repeat some words. Then the audiologist will play beeping sounds into your headphones. You will raise your hand or press a button when you hear these sounds. If you find it hard to answer when you hear a sound, there are other types of tests. One test has you look in the direction of sounds when you hear them. This is called visual reinforcement audiometry. Another test has you play a game with the audiologist. The way you play helps the audiologist know if you are hearing the beeps. This is called conditioned play audiometry. Another test has the audiologist play sounds in your ear and the headphones measure and echo back. You do not have to respond for this test. This is called distortion product otoacoustic emissions, or OAE. Some people have trouble with all these tests. They might need to do a hearing test while they are asleep. Medicine or anesthesia can be used to get the person to sleep. This test is called auditory evoked potential testing. This test shows if sounds go from your ears to your brain. At the end of the test, the audiologist will tell you about your results. Your hearing may be normal in both ears. You may have lower hearing in one ear or both. A decrease in hearing can be mild, moderate, or severe. You may have lower hearing for only certain sounds. You may discuss the cause of a hearing loss with the audiologist. Or you may need to go see a specialist to get more information and talk about ideas for treatment. The audiologist may talk about hearing aids or wait for you to talk to the specialist and your primary care doctor. I hope this video helps you feel ready for what to expect when you get a hearing test. For more videos and other ideas for being healthy, please visit our website, forourhealth.org.